Hello, my name is Dr. Elliot Hirshorn. I'm a board-certified chiropractic neurologist at New Life Functional Neurology and Endocrinology in Greenville, South Carolina. I help people with chronic, unresolved health conditions who haven't been able to get the answers and, more importantly, the solutions that they need from the traditional medical system. If you or a loved one finds yourself in that situation where you've got these unresolved health issues going on and you haven't been able to find any answers and solutions, I want to encourage you that first of all there's hope and you're definitely in the right place. So continue to watch our video, The 7 Keys to Unlocking the Mysteries of Chronic Conditions. What you learn today hopefully will be eye-opening and serve as an encouragement for you that once again there is hope. Let's go ahead and get started. What I want to talk about in the video are in fact the 7 secrets to unlocking the mysteries of chronic conditions. But as we do, I'm going to weave in actual patient cases. These are real people that we have helped and provided real answers and real solutions for. And by the time that we're done, hopefully you will feel encouraged that you too can get some answers and solutions, and we'll talk about how we can specifically help you. I want you to take a look at this picture and answer the question, why are we even having this discussion to begin with? Why are we talking about mysteries of chronic conditions? Why are chronic conditions in many cases going unresolved? I think this picture is a great metaphor for the situation that a lot of our patients find themselves in. So you see these two guys are frantically mopping up the floor. They're trying to solve the problem, but they're addressing the symptom instead of the actual cause. And if they would go ahead and just turn the water off at the faucet, then they could mop up the floor and the problem would be solved. And so this is very metaphoric for our current health system. Just like they're addressing the symptoms instead of fixing the cause, that's what's going on with most of our chronic condition care in the current medical standard of care. As an example, think about thyroid disease. People who have hypothyroidism, they get a medication that has some extra thyroid hormone, and that is necessary in most cases, but it doesn't address the actual underlying cause for why thyroid hormone is actually needed in the first place. For diabetes, blood sugar control is attempted with the medication, but a true understanding of and solution for the reason why the blood sugar is uncontrolled to begin with is rarely pursued. And then for things like neuropathy, which is actually one of the side effects of diabetes, pain relief medications are provided, but again, true restoration of nerve function through rehab is seldom achieved, and furthermore, they're not looking at the underlying causes either. Even for kids who have ADHD as their most common chronic condition, medications are given and there is some symptom improvement, but long term there is no improvement in overall brain function provided from the medications, which are the medical standard of care, and because it's really not getting at the root of the issue as is illustrated in this cartoon. This is an actual ad from many decades ago when doctors were endorsing cigarettes, and so this ad says more doctors smoke Camels than any other cigarette. And obviously, since that time, the status quo of smoking cigarettes has been challenged, and challenging the status quo is always an uphill battle, as it is today. But as new information, new technology continues to emerge, we have to make the changes. If we're so stuck on doing things the way they've always been done, we're going to be in big trouble. I mean, could you imagine seeing an ad like this in a newspaper today? So some of the current practices in medicine we need to be challenged, and even medicine itself is recognizing that, and you'll see that in some of the research that's been done, and this is straight out of the Mayo Clinic itself. Over the last decade, they analyzed different medical practices for certain diseases, and 146 of them were contraindicated, meaning they shouldn't be being done. Furthermore, this article questions how many of our contemporary medical practices are worse than just doing nothing or doing less. So in many cases, the current standard of care is actually worse than if we do nothing for the patient at all. And then with the introduction of the Affordable Care Act and the more government regulation over the healthcare system, a lot of people are being worried that healthcare is becoming too impersonal. And this cartoon, I think, illustrates that well. So most people, when they get to us, they're really motivated to make the changes to improve their health. And so really that's where you need to be, and you need to kind of pause at this point in the video and ask yourself the question, am I willing to make the investment of my time and my effort and even a financial investment into my health so that I can get the answers and solutions that I need. And so if you're thinking, how long can I just avoid your advice, you're definitely not in the right place. But I don't think that's you, because you took the initiative to watch this video. So let's go ahead and continue. As we work with any of our patients, we always ask ourselves two questions. Number one, what do we need to get rid of? So what in the patient's life is contributing to the underlying issues that are going on? Is there a toxin in their environment, whether it be at home or at their office? Are there different allergens that they're being exposed to? Again, is it in the environment? Is it in the food? Is there a food sensitivity? And then, is there an infection? So a lot of our patients will have chronic viral infections. And then we want to look at diet. So what in their diet is contributing to the underlying issues that are contributing to their symptoms? And then stress, as an example. Stress can cause a lot of problems in regards to brain function and gut function and so forth. And then once we figure out what we need to get rid of, then we want to talk about what do we have to add. So of course we want to have whole foods. We want to make sure we have adequate vitamins and minerals, antioxidant support. We want to be able to activate the brain in areas that need activation. We want to provide lifestyle modifications. We want our patients to move. Movement is life. We want to make sure they're sleeping well and feel loved in the community. All of these things are extremely important to overall success in regaining your health. So what are the 7 keys to unlocking the mysteries of chronic conditions? We're going to start with gastrointestinal, gut function. We're going to move into immune and inflammation, detoxification, biotransformation, cardiometabolic, endocrine, energy production, and then wrap up with neurological. There really is a huge gut-brain connection, and you'll see that as we go through these 7 keys. But we're going to start with the gut and we're going to end with neurological. There's not really any particular reason why we're doing it in this order, but I think gut and brain are probably the 2 most important, so we'll kind of use those as bookends. Let's go ahead and get started with gastrointestinal. So why do we want to focus on the gut? Well, the gut is extremely important for a number of different reasons. Number one, it produces 75% of your neurotransmitters. Neurotransmitters are chemicals that signal in the brain. So there you go. The first point demonstrates the connection between the gut and the brain. The gut contains 2/3 of all of your immune tissue. So it's called gut-associated lymphoid tissue, or GALT, and 2/3 of your immune system is actually in your gut. Your gut contains 10 times more cells than the rest of your body combined. It houses a genome 100 to 150 times larger than the human genome, and that is the genes of all of the bacteria in there. 70% of Americans have digestive symptoms or diseases, and the most effective clinical outcomes across all disease spectrums can result from normalization of gut functioning. You'll see that as we go through some of the other keys. You're going to see the gut come up over and over again. So let's talk a little bit about the gut. What are the roles of the gut in general? So digestion and absorption, intestinal permeability, gut microbiota, immune modulation and inflammation, and then the nervous system. So some of these other things that we're going to talk about in relation to the gut are actually keys in and of themselves that we'll come back to later. So when we're talking about digestion and absorption, we're talking about chewing and stomach acid that's breaking down food, pancreatic enzymes, bile, which is used to emulsify fats and help with digestion. So when you're eating, you want to try chewing each bite 30 times. This really helps to initiate the digestive process right in the mouth. It also helps with stress relief. You want to have mindful eating practices overall. And so here you can see those components, the chewing or the mastication. You've got the hydrochloric acid, which is your stomach acid, your digestive enzymes from the pancreas, the bile for the fats, and then throughout the rest of the small intestine, more digestive enzymes to help with the absorption. Looking at intestinal permeability, this is in relation to leaky gut. So the opposite of leaky gut is having an intact barrier, which is critical to normal physiological function and the prevention of disease. So think about the gut barrier like a cheesecloth. Some things can get through, some things can't. The immune system in your gut sees more invaders in a day than the immune system in your blood does in the entire lifetime. Let me illustrate that for you again. So in your gut, remember we said that most of your immune system's in your gut. Well, because of everything that you get exposed to in your gut from your food, your immune system there gets exposed to more things in one day than the immune system in your blood does in your entire lifetime. There's a lot of stuff going on there. And so autoimmune diseases can be helped by working on intestinal permeability, making sure that leaky gut is healed. So what are some of the triggers that may increase intestinal permeability, or what things can cause leaky gut? So obviously a poor diet is going to be a contributing factor, nutrient insufficiencies, and literally stress. If you're too stressed out, it's going to cause permeability in your gut. Things are going to get through your gut that are not supposed to be there. It's going to create an immune response and inflammation. Obviously, if you have an infection or imbalanced bacteria, also known as dysbiosis, a lot of different medications can contribute to it. If you have some sort of underlying disease, that can contribute to intestinal permeability, low stomach acid, different types of toxic exposures. So you end up with this gut that is leaky. Things are getting through it. The cheesecloth is becoming more porous, or the holes are becoming bigger. Things are flooding through. They're getting into your bloodstream. What does a leaky gut lead to? It can lead to food allergies and sensitivities. It can lead to malnutrition by poor absorption. As I mentioned already, it can lead to an immune activation, lots of inflammation, and an overload in terms of your toxic burden. And all of this can contribute to systemic disease. So we have to work our way backwards from the disease and figure out what's going on in the gut, what's contributing to those things in the gut, and address it. Basically all of those things that you see there on the left side of the screen. Let's talk a little bit about food sensitivities briefly, because some people get confused about the difference between a food sensitivity and a food allergy. So food sensitivity is not the same as an allergy. An allergy is an IgE or anaphylactic response. So if you eat peanut butter and your throat closes up and you get hives and it's an emergent situation, you have to go to the hospital, that's an allergy. So food sensitivity is a delayed onset reaction. It may not happen right away. It can happen up to 72 hours after the ingestion of that food. So let's say you eat a food on a Monday and you have some symptoms on a Thursday. You're never going to connect it to what you ate on Monday, because you're not even going to remember what you ate on Monday. Let's be honest, right? So, and the symptoms that you're experiencing, they don't even have to be GI symptoms to have an immune response. So it can be things like seasonal allergies, brain fog, memory issues, balance and coordination problems, skin rashes, and irritation. All of those can be resultant of food sensitivities. Most common food sensitivity is, of course, gluten, and you've heard about that. Gluten sensitivity and being gluten-free is not a fad for many, many people. It provides an extremely effective therapeutic purpose. Moving on to the gut microbiota, and microbiota just means what are the gut bacteria that are helpful in maintaining good gut health. And really, the gut microbiota are 100 trillion of your closest friends, because without them, you would not function, literally. It's been called one of the most complex microbial ecosystems on the planet, the bacteria in your gut. Disruption of this gut microbiome and its interaction with the human GI system has been linked to diseases like allergies, asthma, irritable bowel syndrome, and even obesity. So weight loss issues, if that's one of your chief complaints, again, we have to look at the gut. Gut bacterial influence and control, the gut bacteria, influence and control proteins and chemicals that are involved in brain development and plasticity. So if we're dealing with kids that have neurodevelopmental diseases like dyslexia and ADHD and Asperger's and autism, we need to look at the gut, because that has an influence on whether or not the brain is developing, number one, properly, and then number two, if we're helping the brain with therapy and trying to create plasticity in the brain, we can't do that very well if we have gut issues, and that goes for adults too. Healthy gut bacteria are critical for proper development of the hypothalamic pituitary axis. So your hypothalamus to your pituitary, and then the pituitary secretes hormones that help production of all kinds of other hormones. This is really the heart of the neuroendocrine system, and so mood disorders can be related to dysbiosis. What we eat influences the population and metabolic activity of our gut bacteria. So if we want to make sure that we have a good gut bacteria so that we can prevent some of the issues we've just discussed that can result when you don't have good gut bacteria, then we have to look at the diet. So are we getting good probiotics in our diets? Are we getting good prebiotics in the diet? Do we need to take a supplement of either of those as well? So, gut health is directly linked to neurodegenerative diseases like Parkinson's disease, dementia, and even Alzheimer's disease. In fact, some research shows that Parkinson's disease may actually start in the gut, travel up through the vagus nerve, which is what supplies the gut function. But the vagus nerve originates in the brainstem, which is where Parkinson's disease originates. So as it goes up the vagus nerve into the brainstem, it then impacts the dopaminergic centers in the substantia nigra of the brainstem, and that's what contributes to the Parkinson's disease. So that's one of the theories. But if you take a look at this particular picture here, when we got dysbiosis here in the upper left-hand corner, that's a bacterial imbalance. That can lead to inflammation in the gut. Inflammation in the gut, usually from an immune reaction to a food sensitivity or an infection, that's going to create production of inflammatory cytokines, which can lead to leaky gut, which can cause more food sensitivities, and you see we've got a little vicious cycle going on here. Those inflammatory cytokines can cross into the bloodstream, which means they're going to go everywhere, including across the blood-brain barrier. Once the inflammation gets into the brain, that's going to react with immune cells in the brain, and we're going to have a microglial response. Microglial cells are the macrophages, or the cells that gobble up all of the bad stuff, and so it's going to cause inflammation in the brain, which in certain cases is important, but prolonged chronic inflammation in the brain can lead to changes in brain function. So we're going to have cognitive impairment, behavioral changes, and eventually neurodegeneration. So we have to look at gut function as it relates to Parkinson's, dementia, and Alzheimer's as well. This is showing, this is a diagram from an article in Central Nervous System and Neurological Disorders, and it's talking about non-celiac gluten sensitivity with irritable bowel syndrome on top of that. So non-celiac gluten sensitivity is what we talked about. It's not celiac disease, it's not an allergy, it's a sensitivity to gluten, and it's associated with gut dysbiosis, so bacterial imbalances, gut inflammation, and leaky gut. This creates a systemic inflammatory response. This ends up getting into the brain and causing gut-brain axis dysfunction. This oxidative stress gets to the hippocampus and the cerebellum. Hippocampus is where we have short to long-term memory conversion. Cerebellum is where we have balance and coordination. And this leads to the amyloid deposition, tau phosphorylation, neurocognitive impairment, and increased vulnerability to dementia. So this is just showing you in a little bit more detail, maybe then you'd like to know the literal connection between the gut and the brain. So what are the effects of the environment on your gut bacteria? So your genes can have an impact, your age, what you're eating, whether or not you're taking probiotics and feeding them with prebiotics, whether or not you're taking any antibiotics. Antibiotics don't just kill the bad bacteria, they will kill the good ones too. What was your environment like during prior to birth, during birth, and during infancy? All of that has a great impact on what your gut microbiota look like. Fourth thing we want to talk about in regards to functional roles of the gut is the immune modulation and inflammation. And this is actually a key all by itself, which we'll come to later. But as it relates to the gut, we want to talk about, is it the genes or is it the environment? Where's the front lines when we're talking about that conversation is in the gut, because 70% of your immune system, as I mentioned, is actually in your gut. So what is tolerance? Tolerance is your ability of your immune system to literally tolerate exposure to certain things. And so you want to be tolerant of your foods, right? You don't want to be intolerant of foods, because that's what's causing a sensitivity. And so this article found that a lower prevalence of reported allergies in kids aged 7 to 8 years old from families who use hand dishwashing instead of machine dishwashing. So let me restate that and say that those families who hand wash their dishes had kids that had fewer allergies. And the reason why is because they were exposed to more things, because the hand washing of the dishes was not as sterile, so to speak, as the machine dishwashing. This effect was made greater if they ate fermented food or bought food directly from farms. And so when they're eating fermented foods, which are essentially probiotics, or they're eating food directly from farms, again, they don't have all that sterilization process that you would if you're eating processed foods. So this is really important. Again, when your kids are growing up, you want to just send them out and play in the yard. You want them to pick food off the garden in the backyard and eat it, and you want to wash your hands, but you don't want to in fact, some of the antibacterial soaps are now being banned, so you don't want to use antibacterial soaps. You want to use the natural soaps. And then same thing with the dishes. If you can do some hand washing, it just leaves some more exposure to things that's going to help develop a tolerance to environmental allergies, to infections, and to foods as well, which is really important. Inflammaging. The overexpression of inflammation genes, the immune response genes, and the genes associated with lysosomal systems. So what does all this mean? Your immune system cells encountering a foreign antigen or something that they don't recognize, they become activated. So when they see chickenpox virus, they become activated, and they release a whole bunch of factors leading to clinical signs of inflammation. So let's say, for example, you get let's not, instead of chickenpox, let's talk about poison ivy. So you get some poison ivy oils on your skin, you're going to get inflammation. You're going to have redness, it's going to be hot, it's going to be painful, and then you're going to have some swelling. Those are those clinical signs of inflammation, and that's localized on the skin. But those same things happen systemically when you have systemic inflammation as well. And the strongest predictor of disease progression is the extent of your chronic systemic immune activation, and therefore inflammation as well. And so inflammation is one of the things that we test for when we're working with patients, because we want to know how much inflammation you have, and then we need to determine where's it coming from so that we can eliminate the source and then quench the inflammation with diet and nutrition. And finally, the nervous system in regards to the gut. We'll get into the neurology a little bit more later, but the gut has its very own brain. It's actually called the enteric nervous system, and it helps to control the motility or the movement of things through the gut. It helps to control blood flow to different parts of the gut. It helps to control the absorption, your immune function, and also inflammation, as well as the permeability of the gut. So you start to see these things are all tied together, and not one is really independent of the other. The enteric nervous system in the gut is heavily influenced by your gut bacteria. As I just said, these 4 or 5 things we've just gone over are heavily tied into one another. And so if your nervous system in your gut is influenced by the gut bacteria, then again, that further reinforces the idea that your gut bacteria have to be ideal. And so this is also influential to your brain or your central nervous system as well, so that they do talk to one another. So how do we assess the gut and how do we care for it? So there's a bunch of different tests that we can do for gut function. You can do a comprehensive stool analysis, which is going to look at different digestive markers to see whether or not you're digesting carbohydrates, for example, and fats. It's going to look at dysbiosis, so how much of the good bacteria versus bad bacteria do you have. It's going to look to see if you have any types of infection, as an example, as well. So it's a very good tool to identify any dysfunctions that might be going on. We can use that certainly, or we could just treat the gut, because most people have problems with gut, and so we could just go ahead and address it. And then if we still have unresolved issues, then we can go ahead and test later. It can be somewhat of a patient preference, or as the doctor, we can decide if that's necessary. But once we determine what's going on, then what we want to do with the gut is, number one, we want to heal the gut, especially if we've got leaky gut. We want to improve digestion, maybe with some digestive enzymes, balance the bacteria with probiotics and prebiotics, regulate the immune function, things like vitamin D and other things that stimulate the regulatory system of your immune system, turn off the inflammation, whatever is contributing to it, and then dampen it with things like turmeric and resveratrol, And then we want to improve nervous system control, so maybe there's some brain therapy or exercise that we can do to help stimulate vagal control over the nervous system. And that could be simple as humming, gargling, singing. All of those things stimulate your brainstem, which is where we have vagus nerve control over gut motility. So that's just from a therapeutic standpoint another way that we can go about doing that. Let's talk about a real person. His name is Scott, and Scott had acid reflux and fatty liver. So fatty liver is not so much of a symptom, so to speak, but he had a family history of it and was very concerned about it. But the acid reflux obviously was a symptom, causes a lot of pain. And Scott was actually worked in the pharmaceutical industry for 30 years. So he had an intimate knowledge of what was going on with medications and in the pharmaceutical industry. And after hearing me talk, he decided to make a change to his diet. He did that for quite a while, and it was kind of funny. I would see him, and his pants were getting bigger and bigger. Well, not really. He was getting smaller and smaller as he was losing weight after he changed his diet, and he decided to say, "Hey, I wonder if my reflux is better, eating differently." So he stopped his reflux medication on his own, of course, not at my direction. And surprising to him, he had no reflux. So changing his diet, not only did he lose weight, but his gut function improved to the point that he did not have any more of the acid reflux. And he said, "I knew I needed to make this change, but it was hearing Dr. Hirshorn's talk and reasoning that put me over the edge. I have never felt better. I reclaimed wardrobe that was collecting dust. Thanks, Dr. Hirshorn." So it's stories like Scott that really make what we do in our office so rewarding, because we help literally to change lives. We provide hope where there was none before. So let's move on to the next key. Having just finished talking about the gut and how intimately related the immune system is to it, it makes sense just to move right into our next key to unlocking the mysteries of chronic disease, and that is inflammation and immune system. Inflammation is the body's normal response to defend and repair itself. It becomes a problem when this is chronic and ongoing because it doesn't get shut down properly. And most chronic diseases have been linked to persistent, ongoing inflammation. Things like eczema, autoimmune diseases, gastrointestinal issues like irritable bowel syndrome, gluten intolerance, even cardiovascular disease, neurodegenerative diseases like Parkinson's and Alzheimer's, multiple sclerosis, cancer, diabetes, schizophrenia, depression. There is literature for all of those being linked to inflammation and immune system issues. Now, drugs help to focus on the consequences of the inflammation, but what we do in functional medicine works upstream by addressing the causes and the mediators of the inflammation. It can be dampened with diet and lifestyle modifications and anti-inflammatory nutrition. So let's talk a little bit more about the inflammatory part of things. When an acute inflammatory responses don't turn off, why does this happen? Well, it could be a genetic predisposition. It could be related to foods that you're eating, and there are things called advanced glycation end products, or AGEs, and this develops in certain foods, especially when you cook meats, especially in the microwave. Lack of antioxidants or phytochemicals, and antioxidants help to quench free radicals that are produced during normal metabolism. And if we don't have adequate antioxidants, those things build up and create oxidative stress, which leads to inflammation. And you could just have a bad off switch, so that off switch that's supposed to turn off the inflammation just may not work well. And so in the pharmaceutical model of inflammation, you can see here that they're using pharmaceuticals to come in here and basically block the cascade of inflammation. So this pathway leads to inflammation. You see the different types of medications: aspirin, ibuprofen, acetaminophen. All of these are blocking the pathway to get to inflammation, but they're not going upstream to figure out why are we having inflammation to begin with. But that is what we do in functional medicine. So as a model of the inflammatory process, we want to look to, okay, starting at the bottom here, we have symptoms of inflammation when an osis becomes an itis with increasing severity. So as we step backwards, we want to look at function, and it shifts the physiological state into alarm reaction characterized by an inflammatory process. We want to look back at diet and micronutrients, phytonutrients, but beyond that, we want to look at genes, And then also the environment, allergens, toxins, stress, trauma, how's that influencing the genes, and then how's the diet influencing the genes, and how all three of those things impacting function and therefore the onset of inflammation. So we want to get back to the root causes. Yes, we still do intervene with anti-inflammatories, but we want to use natural agents rather than synthetics while we address the actual causes. Many chronic conditions have an immune component. So there's three different aspects of this that I want to talk about. One is an immunodeficiency. So when we do comprehensive baseline blood work on all of our patients, we measure your global ability to produce immunoglobulins or Ig antibodies or IgG and IgA antibodies. Part of the reason why we do this is because it lets us know whether we can do some other testing down the road, but it also gives us an accurate indication as to whether your immune system can even mount a response to a bacteria or a virus. And too often than not, I've seen multiple people that have had lowered systemic IgG and IgA responses, which means they can't fight off things, and these are the people that probably are sick more often, which leads to the infection component. And oftentimes, especially more recently, as we're doing more extensive pathogen testing, we are finding that people have chronic underlying viral infections that are driving their symptoms, and I'll share an example of that with you in just a second. And then autoimmunity, this is one of the biggest areas of chronic conditions that we help people with. So autoimmunity, if you don't know, is when your immune system is actually attacking your own body's tissues. Most common, or one of the most common, is with thyroid disease. And with thyroid disease, the immune system is attacking the thyroid. The thyroid would make hormone just fine if the immune system would leave it alone. So when we were looking at autoimmunity, there's a couple different stages to it. And the first stage is your body starts to make antibodies that attack whatever the tissue is. So let's use thyroid as our example. Your immune system starts to make antibodies to your thyroid, just like it would make antibodies to chickenpox or the common cold. And then eventually, as those antibodies start to tag and destroy your thyroid, you eventually start to get hypothyroid symptoms. Or if it's attacking your joints, you're going to get rheumatoid arthritis symptoms, or whatever it's attacking is going to eventually create symptoms. But you can have antibodies and symptoms and still not meet the diagnostic criteria for an actual disease. So you still might have symptoms and antibodies, but your TSH isn't impacted to the point where you get a classification as hypothyroidism or Hashimoto's hypothyroidism. And this is why people have so-called normal labs and they feel terrible still, especially associated with thyroid. But eventually you may get to the point where as it progresses you have antibodies, then you have symptoms, and then you finally meet the diagnostic criteria, and that's when you finally get some help in the traditional medical system. Is once you get classified with a diagnosis, then they're going to give you medication, and even the medication at that point may not be the medication alone may not be the best approach. You probably need support with diet and nutrition as well. But we can start with diet, nutrition, lifestyle modification, neurotherapy, whatever you need, even at the antibody stage. And potentially we can help slow down the progression through these stages. Ultimately, when you have autoimmunity, you're always going to have it. Once you have one type of autoimmunity, you're 50% more likely to have more than one type of autoimmunity. And our goal is to reduce the frequency, duration, and intensity of your autoimmune flare-ups. And we can get into more later about why autoimmunity doesn't go away, but think about it in terms of how vaccines work. They're trying to create a memory in your immune system where your immune system is always going to remember to attack your thyroid, and you can't really make it go away. You can just help to support thyroid function, support immune regulation so that it doesn't do it as often. So let me share with you two stories. First story is a patient, and we will call her DM. And she came into our office and had brain fog, memory issues, hair loss, weight gain, gastrointestinal. Most commonly we see with that is alternating constipation, diarrhea. She was extremely fatigued, not sleeping well, and she already knew she had been diagnosed with Hashimoto's disease. So she had gone to that stage 3, so to speak. She had the antibodies, she had the symptoms, and she had the diagnosis. So as I mentioned, once you have one type of autoimmunity, you're 50% more likely to have more than one type of autoimmunity. And so whenever we see Hashimoto's, in almost all cases, we do a multiple autoimmune reactivity screen, and that's what you're seeing here in this test. And what we do is we test multiple different tissue types to see, is your immune system creating antibodies to other tissue types? Then we correlate that with your symptoms. If you're having gut issues and you're making gut antibodies, now you're in that antibody plus symptom stage, but you may not actually have diagnostic criteria, which is why your medical physician may not have given you a diagnosis yet. In any case, when we do the test, we're looking at equivocal and out of range. Anything in these categories is elevated levels of antibodies beyond normal and potentially contributing to symptoms. So for her, she had parietal cell and ATPase, which is gut, intrinsic factors gut, ASCA and ANCA is gut, tropomyosin can be gut related, thyroglobulin and TPO, thyroid peroxidase, or thyroid, those would be expected because we already knew she had Hashimoto's. Myocardial peptide is heart, phospholipid could literally be every cell in the body. Platelets have to do with blood coagulation. GAD65 has to do with cerebellum as well as insulin resistance and blood sugar regulation. And then she even has 2 antibodies related to brain function. So she has multiple autoimmunity. And if we look down her symptoms, brain fog memory, and we've got brain antibodies. We've got GI symptoms, GI antibodies. And so we make that connection and say, okay, these are the areas we need to focus on. We need to support better function of those tissues, and we need to support immune regulation so that your immune system stops attacking these areas so frequently, so intensely, and for long periods of time. And if we can get the better, if we can ultimately create the good days being better and the bad days being better and having fewer bad days and so forth, that's ultimately our goal when we're talking about autoimmunity. Second patient is more along the infection side, so we'll call her AR, and she came in with somewhat similar symptoms: brain fog, skin issues, hair loss, lack of motivation, migraines, reflux, bloating, and a lot of fatigue. She also had we did our comprehensive baseline blood work. She also had insulin resistance was pretty significant, as well as inflammation. And so we worked on her with diet and regulation of blood sugar and the inflammation, and she was getting better, but we were still missing something. And so eventually we ran a comprehensive pathogen screen on here, of which you see a portion of. And she wasn't really cracking her goals, so to speak, in regards to fatigue. So we ran this panel, and as you'll see, she had positive for a number of different chronic viruses. The first 3 have to do with Epstein-Barr and cytomegalovirus, both of which are significant in regards to fatigue. And once we started addressing the viral load, she got much, much better in terms of the fatigue. She had a lot more energy, and she says, I feel like once we addressed the infection, that's when I noticed the most significant increase in the energy. So again, this is a perfect example of where the key of addressing the immune system and inflammation really played out in terms of addressing the cause for this patient, and then ultimately helping her to function better, and now she's feeling much better as well. The third key to unlocking the mysteries of chronic conditions is detoxification, or biotransformation as it's also known. So exposure to toxins in our environment is really widespread, and it's increasing every year. The total load on the body can cause physiological dysfunction, which can lead to chronic illnesses, especially to those who are more susceptible. Now, that susceptibility is determined by a person's ability to biotransform, detoxify, and eliminate those toxins from within their body and from the environment. And lifestyle, diet, and nutrition can enhance this detoxification or biotransformation process, thereby helping to possibly prevent disease and especially to restore health if it's already gone in that direction. Let's look at some of the statistics. So since World War II, more than 85,000 synthetic chemicals have been registered with the EPA. And every year at this point, we're registering about 2,000 new chemicals. And those are being introduced in things like food and personal care products and medications and cleaners and pesticides. And all of these things that we're exposed to every day or use every day have these synthetic chemicals. More than 3,000 of the total synthetic chemicals are actually made in very high volume, which means more than 1 million pounds a year of each of these 3,000 chemicals. So you can imagine the immense exposure that we have to these things that really weren't around 100 years ago. One of them is called glyphosate. It's the active ingredient in Roundup, and it's just one of 167 chemicals and pollutants that were found in the blood and urine from 9 volunteers who didn't work with chemicals and didn't even live near an industrial facility. So they found glyphosate and 166 other chemicals in people that you wouldn't even expect it to, just an average person. On average, 53 of those 167 chemicals was a carcinogen. And even low levels of these chemicals are very significant because they can act as endocrine disruptors, meaning that they mimic and influence the endocrine system and hormone production and physiology. BPA is another one that you've probably seen before. You may have seen BPA-free bottles, etc. But you can also get it from store register receipts. Many of them contain BPA. BPA is a commercial plasticizer. It's made in the quantity of billions of pounds per year. In fact, 8 billion pounds per year. It lines the inside of your cans, your bottles, cash register receipts. Hundreds of tons of it's released in the atmosphere every year. It can be easily absorbed through your skin and through your gut. And when measured, 90% of people in the United States have BPA in their bodies. So as I mentioned, this is an endocrine disruptor, meaning it mimics the effects of hormones like estrogen and interferes with normal cell signaling. Increased amounts in the urine have been associated with things like diabetes and obesity, heart disease, liver inflammation. It's also been linked to cancer, thyroid issues, and infertility. So why is BPA having so much of an impact on the endocrine system? Is because it was actually originally developed as a medication to alter endocrine function. So it's quite obvious that it would impact endocrine function when we're exposed to it in our environment, because that was its original intent. And so if you look at this picture here, you see that receipt paper, and then you go ahead and sanitize your hands, which enhances the absorption of that BPA. And then you touch your french fries and it gets into your stomach and goes to your liver and gets into your systemic circulation and then can go to the kidneys, and you'll find it in the urine. You can also have transdermal absorption through the skin, and that'll get into the subsystemic circulation as well. And so 2 different routes, but ultimately most of us have BPA in our bodies, and it has an impact on our endocrine function. There's a new concept called the exposome, and really what this means is it's the combined exposure of everything that gets into our bodies, because it's not just BPA, it's all the chemicals that were found in those 9 volunteers that didn't have more than average exposure to anything. All these different chemicals make up our exposome, and there are certain tests that can detect the impact of various components of the exposome. But things like radiation and stress and lifestyle, infections, drugs, diet, pollution, it's all of these things that make up our exposome, not just toxic chemicals, but even just our lifestyle, stress, and diet play a role in that as well. So essentially, you are what you eat, what you drink, what you breathe, what you touch, and what you can eliminate. So if you cannot eliminate, detoxify, and biotransform things, it's going to have an impact on your physiological makeup. So your total toxic load is, we can think about it in this equation, is equal to your exposure minus your ability to biotransform and excrete. So whatever you can't biotransform and excrete is going to remain in your body, and that's your exposure. So detoxification sometimes has a negative connotation, like you're going to be on the toilet all day. But detoxification is actually a natural process in your body that you have to go through to eliminate those toxins that you're exposed to. So that's why we use a different term for it. It's called biotransformation, and it's essentially the change of chemical toxins into less harmful forms that can be excreted, usually in the urine. So biotransformation itself is constantly active. It's always going on. It's very energy dependent. It's very nutrient dependent. And it's also what we call polymorphic, which means it varies between individuals. So let me give you an example. We all have friends who can drink coffee and fall right to sleep, right? So they are not biotransforming that caffeine properly. And so therefore it's not having an impact on their system. Biotransformation happens in many different tissues, including the liver is the biggest one, but also the gastrointestinal system, which is where we have a lot of bacteria that are involved in that biotransformation process, and that's where a lot of the variability comes with biotransformation, is because we have different micro ecosystems of bacteria from one person to the next. Therefore, we have different abilities to biotransform. It also happens in the lungs, kidneys, the skin, and also at the blood-brain barrier as well. And so lots of different things can actually go wrong with this process. It can be impacted by your genetics. So what's your genetic susceptibility? What you eat, so your diet, what you eat and drink, different hormones, your gut bacteria, and then supplements can also have an impact on your biotransformation process, which is good because we can use supplements to enhance biotransformation if we need to. And so this process can be sped up or slowed down, biotransformation that is, and this can have an impact on the effective dose of medications, for example. So maybe your medication dose has been changing, the need for more and more medications, or less and less, or you feel like the dose that you're on is becoming too strong. This can all be indication of changes in your ability to biotransform that drug. And so if you're eliminating it more efficiently, then you're going to need more of a higher dose potentially. Or if you're not eliminating it, your effective dose is higher and you might need a lower dose. So it's pretty complicated when you think about it, how this biotransformation process can impact just the dosage of your medications. So what influences whether or not you're going to be sensitive to different toxins? Well, first of all, the total load of those toxins, whether or not you can eliminate them, whether or not you have dysbiosis in your gut, nutrient deficiencies, high sugar, low protein diets. Essentially, that's the standard American diet. Oxidative stress, inflammation, emotional stress, genetic differences, all of these things have an influence on whether or not you're going to be sensitive to certain toxins. That's why some people have multiple chemical sensitivities and other people can be exposed to the same things and not really have any symptoms because their ability to get rid of it is intact. So from a functional medicine standpoint, what can we do to improve biotransformation? Well, number one, you want to avoid exposure to things that are harmful. So smoke, amalgam fillings, synthetic pesticides, cleaning agents, use non-toxic building materials, use natural personal care products, eat fresh organic foods, not out of containers, drink purified or spring water. All of those things go a long way to minimizing your exposure. Then you want to optimize your bowel health because remember, part of your biotransformation happens in your bowel. Avoiding things that you're sensitive to, going through a bowel rehab program, gut repair, making sure you have adequate, or make sure that you don't have dysbiosis. Enhancing excretion, so exercise is going to make you sweat. It's going to excrete out those toxins. Saunas will do that. Enhance your bile flow, and then enhance your antioxidant reserve. So antioxidants help to get rid of toxic byproducts in your system. The most prevalent one in your body and the master antioxidant is glutathione. So just kind of backing up a little bit, going back up to bowel health, I kind of went through that pretty quickly. What does a bowel rehab program involve? Well, it's usually involved with the 5 R's. So you want to remove pathogens, replace enzymes and acids, repair the gut lining, reinoculate with pre and probiotics, and then rebalance everything. In terms of the excretion and enhancing bile flow, you can use different types of supplements. Milk thistle is helpful for that, turmeric, berberine. And then antioxidants, aside from glutathione, you can use N-acetylcysteine, which pushes glutathione, curcumin, berries, green tea. And then other things that help with glutathione, vitamin C, lipoic acid, and also curcumin and milk thistle again. You also want to downregulate inflammation using essential fatty acids and assist and balance natural biotransformation. And you can do this, again, diet is huge. You can eat all these things. Proteins, fruits, vegetables, broccoli is huge with the sulforaphane, turmeric, garlic. You can take supplements of these, you can eat them. Some of them you just need to take the supplements to get an adequate dose. And then proper methylation. So this is a whole other topic, but methylation is a process by which you add a methyl group on. It's extremely important for about 250 different biochemical processes. It's dependent on proper gene function, and many people, about 30% of people in the United States, have a defect in the gene processing, and it impacts their ability to methylate and can lead to all kinds of different symptoms, including difficulty with biotransformation. This is a pretty funny cartoon. We can save the most money by downsizing the unhealthiest workers first. Well, how do we know who they are? We'll close the parking lot that's nearest the building. And they go out and look. Should we help them? It's too late for broccoli. So don't wait too long. Ultimately, these negative impacts have a cumulative effect. So if we jump in sooner than later, we have a better chance of having a positive impact on things. So let's talk about a real live patient with a biotransformation issue. So we'll call her MG. Some of her presenting symptoms: shortness of breath, hair loss, muscle pain and weakness, fatigue, blood pressure, diarrhea, brain fog, menstrual issues, weight. So some of the common ones here that oftentimes can be associated with biotransformation: some of the blood pressure, shortness of breath, the muscle pain, weakness, the brain fog, menstrual issues for sure, and weight. And part of the reason why the menstrual issues can be related to biotransformation is you need to biotransform your hormones. They cannot stay in your body for extended periods of time. You need to break them down. And if you don't have proper detoxification and biotransformation, especially in the liver, you will not break down your hormones. Your hormone levels will stay elevated and cause problems with those systems. So this is a partial report from an organic acids test, and you can see hepatic phase 1 and phase 2 detoxification is not functioning well. And as I mentioned already, N-acetylcysteine they're recommending as a support to help improve that process. So with this particular patient, she's doing really well. We did this and addressed some of the other issues that we found not only in this test but on all of the testing that we did with her. Her symptoms are anywhere at this point between 80 and 100% improved. She's doing fantastic, and she's very excited that we helped her biotransform better. The fourth key to unlocking the mysteries of chronic conditions is cardiometabolic. This one is very prevalent in the United States. So let's take a look at the statistics. Someone in the United States has a heart attack every 34 seconds, and every minute someone in the US dies from a heart disease related event. 2 out of 3 people in the US have heart disease, and for 50% of them, the first sign of that heart disease is a fatal heart attack. And most of this is actually preventable. And ultimately, 2 out of 3 of your best friends will die of heart disease, and for one of them, that first sign is that sudden death. Most people in the United States actually fit the morbid obesity category. There is a genetic component, but it's also what you're exposed to. What have you been bathing your genes in your entire life? Let me give you an example. Think about Native Americans. They were fit and they were lean and they lived off the land. They had the genes for that, and they still do have those same genes, but when those genes are bathed in the Western diet and culture, they have the same heart disease and diabetes that the rest of America does. Food essentially is information. It turns on good or it turns on bad genes, and it can turn on and off bad genes. And so we want to be able to use food as medicine in this regard. So what is cardiometabolic syndrome? You have to have 3 of the following in order to qualify. Waist size greater than 35 inches for men, 40 inches for women. Blood pressure of 130/85 or greater, or on hypertension medications. Fasting blood sugar over 100, triglycerides over 150, and a good cholesterol HDL less than 40 for men and less than 50 for women. The question is, should you wait until you have 3 or more before you do anything about it? This is a process, and during the process of gaining these qualifications, you're destroying parts of your body. And so we advise from the functional medicine standpoint that you start working on this right away. For both heart disease and diabetes, both of which are in this cardiometabolic category, the root cause is inflammation, or the root of the issue, I should say, is inflammation. So let's talk about when we have inflammation driving heart disease and diabetes. What are the consequences of this? You can see that weight gain, obesity, cognitive decline, which is also called type 3 diabetes in the literature, sleep issues, problems with cholesterol, high blood pressure, clogging of the arteries, cardiovascular disease, stroke, even erectile dysfunction. And really, erectile dysfunction should be considered a cardiovascular issue until proven otherwise. So what's the fix? If we have high cholesterol, do we need to take cholesterol medications? Well, 50% of people that have heart attacks have normal cholesterol levels. Number of different studies, the Jupiter study, they reduced only LDL with cholesterol medications, and there was no benefit. If they reduced LDL and CRP, which is inflammation, then there was a benefit. So the difference is the inflammation. In the Navigator study, they reduced lipids, glucose or sugar, and blood pressure with medications, and there was no change in morbidity or mortality, and that's because they didn't address the underlying inflammation associated with what was going on. There was insulin and glucose, both of which are very inflammatory. And so cholesterol medications don't really provide a whole lot of benefits for most people in terms of cardiometabolic function, and they have a lot of side effects. They increase the risk for diabetes, especially in women. They can cause muscle fatigue, muscle pain, and have also been linked to neuropathy and even Parkinson's disease. So if it's not the cholesterol, should we fix the plumbing? Well, your arteries and veins are not just a pipe. The vessel wall is actually one of the most complex, complicated, and diverse endocrine organs in your body. And it's an inflammatory process that's more complicated than just good versus bad cholesterol. So if you look at this progression of atherosclerosis, you have inflammation in the artery wall. That starts to get thickened. You start to see some calcium buildup. You do see some plaquing. But what causes the rupture of that plaque, which then can lead to a clot and heart disease or stroke? We all have some level of this plaque, and the C-reactive protein and other inflammatory markers are what create the bursting of the plaque. So it's the inflammation that we need to be concerned about when it comes to the atherosclerosis. If we can reverse the inflammation, we can decrease the risk of that plaque rupture. So what are the upstream causes? Again, with functional medicine, we want to address those, but measuring things like blood sugar and lipids and blood pressure and trying to control them on this end of things really is working on the downstream risk factors, and this is what traditional medicine does. But functional medicine, we want to work on the upstream causes. How are the genetics, lifestyle, environment impacting things? Is there inflammation? If so, what's causing it? Is there insulin resistance? If so, how can it be reversed? Is there oxidative stress? From what? Is there autoimmunity? What caused it? Is it spreading? It's not as simple as just trying to keep these lab markers inside a certain range. We want to dig deep and figure out what the underlying driving factors are. That's the only way we're going to have lasting change. What about looking at the glucose and the A1C? As I mentioned, it's more important that we manage these spikes and crashes. these spikes and crashes of your glucose may be an independent risk factor for diabetic complications outside just looking at the A1C. So a lot of times we'll measure the glucose and we'll measure it again in 3 months, and we'll look at the A1C and we'll measure it again in 3 months, and this is good and you should do those things. But the spikes and crashes in between, even if those numbers are good, are just as important in terms of risk factors. And both high blood sugar spikes and low blood sugar crashes can lead to inflammation. And then environmental toxins can also drive inflammation and diabetes, and so that ties the cardiometabolic into the detoxification and biotransformation that we just talked about. You also need to manage stress. So uncontrolled stress can cause blood vessels to tighten and platelets become more sticky, and so you form clots more easily. So someone who has a type A personality is going to have an increased inflammatory markers like CRP, homocysteine, and fibrinogen. So you need to make sure that you have some quiet time for yourself, that you're managing your stress properly. Because stressors can increase and promote atherosclerosis, as you see here. Then you want to look and ask about whether or not you've been properly assessed for cardiometabolic function. So has your waist to hip ratio been measured? There are certain ratios that have increased risk for cardiometabolic dysfunction. Has your triglyceride to HDL ratio been measured? Yeah, they look at your triglycerides, they look at your good and bad cholesterol, but they're looking at the ratios. This particular ratio is very indicative of increased risk factor for cardiovascular disease. You also want to look at the HOMA score. So the HOMA score tells us whether or not you're insulin resistant. It tells us how sensitive your cells are to insulin, and it also tells us how hard your pancreas is working. Is it working overtime to make more insulin because your cells are not sensitive? This is very important to use this calculator. I often find insulin resistance in people who have a normal glucose, a normal A1C, and maybe even somewhat normal triglycerides, and they're still insulin resistant when we do it in this calculator. If you're concerned about lipids, before we get on a statin medication, let's run a more advanced lipid panel. The standard LDL HDL is really outdated to use alone by itself. The LDL has 4 different subtypes: 2 large particles, 2 small particles. The large particles are fluffy and friendly, and the small particles are sticky and not so good. So if we can figure out what the breakdown is, are your LDLs mostly large and fluffy? If they are, you're fine. If they're small and sticky, okay, maybe we need to consider looking at the medication. And then you want to look at genetic risk as well. Of course, if you have a family history or certain genetic factors that predispose you to hypercholesterolemia, then you may need to be on a medication, and that's the only way you can control it. But that's less common than just the standard American diet and lifestyle contributing to cardiometabolic disease. So let's start with the least invasive things first. So lifestyle modifications are superior to metformin, and this was in the research. The New England Journal of Medicine, the standard bearer for medical research, shows that there was a 58% reduction of diabetes with lifestyle compared to only a 31% reduction of diabetes with the standard of care in medicine, which is metformin. So let's use food as medicine. Let's use nutrition. Let's move and exercise. So foods that are harming you, get rid of them. Use whole foods to heal you. Nutrition, you can use anti-inflammatories, omega-3s, based on what you need from your blood work. And research has shown that movement and exercise actually increases your sensitivity to insulin, and that's why it helps with your diabetes. Okay, let's talk about diabetes in real life. Patient number 1 that I want to talk to you about, she came to see me for dystonia, and which is a movement disorder. And part of her plan, of course, included meal changes. And we always recommend that people do these as a family. So her husband did it too, and he had diabetes. And after like 2 months, he came in and was ranting and raving about how much better his blood sugar was. We didn't even run any blood work on him. He was not technically our patient, but he just did the diet with his wife to be supportive, and his diabetes got better. Amazing. Very cool story. Second story, we'll call him GR. And these are some of his numbers. In just 3 months, his A1C went from over 6.5 to almost 5.5. So it was over a 1 point decrease in just 3 months. His glucose went from over 150 to below 100. His LDL got better, his HDL improved, his triglycerides came way down. His numbers improved greatly. And again, we don't necessarily want to rely just on these numbers, but we do want to make sure that they're moving in the right direction, obviously. Okay, key number 5 to unlocking the mysteries of chronic conditions is in the endocrine system. The endocrine system and the nervous system, the central nervous system, are intimately connected, and that connection happens in the hypothalamic pituitary axis. This is the center of the neuroendocrine system. The brain is involved, and some of the most important endocrine systems are involved in this as well. And their function originates in the brain, and each pathway is influenced by and impacts the others. So you have the hypothalamic pituitary thyroid axis. You have the hypothalamic pituitary adrenal axis and the hypothalamic pituitary gonadal axis. So we're going to look at each one individually, but you can see that each one influences the others, and they all have feedback loops up to the hypothalamus as well. So the hypothalamic pituitary axis, when we have symptoms that are similar to hypothyroidism, that include fatigue, needing lots of sleep, cold hands and feet, weight gain, difficulty with bowel movements, depression, lack of motivation, hair loss and thinning, dry skin and scalp, mental sluggishness. All of this is hypothyroidism. And we have an entire video just on thyroid. You can watch that separately. But testing for thyroid in the traditional standard of care is inadequate, to say the least. There are 24 different patterns of dysfunction at a minimum, and the most common one is rarely tested for. So watch our thyroid video and we go into a lot more detail there. Hypothyroidism is much more common than hyperthyroidism, but with hyperthyroidism you might see symptoms related to heart palpitations, trembling, anxiety, insomnia, night sweats, and even difficulty gaining weight. So as you can see, the hypothalamus secretes thyrotropin releasing hormone, which goes to the pituitary, which secretes TSH, which reaches the thyroid and stimulates production of thyroid hormone T4 and T3. T3 is the metabolically active form that acts on your target tissues to drive metabolism. When you don't have enough thyroid hormone, you don't drive metabolism, and you get all of those hypothyroid symptoms. Some of the times the problem is related to conversion of T4 to T3. Most of what you make from the thyroid is actually T4. You have to convert it in your liver, gut, and muscle to T3. And if you have a problem down in this pathway here, that will also lead to lowered levels of T3 targeting your tissues, and you will end up with hypothyroid symptoms. Circulating blood levels of T4 and T3 provide a feedback loop to the pituitary and hypothalamus so that they can monitor levels and then correspondingly change output if necessary to make more hormone. The thyroid drives the metabolism of all of your cells, including those of your adrenals, your gonads, and your brain. So without proper thyroid hormone metabolism, all of the other systems, parts of this system, will be impacted as well. So thyroid has an impact on brain, it impacts adrenals, and it also impacts reproductive system. The hypothalamic pituitary adrenal axis. The adrenals are really the most forgotten system in traditional medicine. Sometimes they get tested and a simple 8 a.m. cortisol is drawn by blood. It's really inadequate and also unreliable. So number one, it's inadequate because your cortisol levels change throughout the day. So to get a good clinical picture, you want to test them throughout the day. So we do a 4 sample saliva test throughout the entire day. It gives us a good picture of what your cortisol rhythm looks like. And we use saliva, number one, because it's convenient if you're doing a 4 sample test, but also you don't have the impact of using a needle. So if somebody comes at you with a needle, your stress response is going to increase, and so is your cortisol level. So it can actually impact the test by doing it by blood. So if you have high cortisol levels, that can prevent you from falling asleep. You're sweating a lot more, lots of stress, but your response is poor. You gain a lot of weight. You're tired even after lots of sleep. Low cortisol, you can't stay asleep. You're craving salt. You're slow in the morning. You're slow in the afternoon. You get dizzy when you stand up. Afternoon headaches, headaches with exertion or stress. So a lot of these symptoms um, necessitate proper identification of what's going on in the adrenals and then addressing it therapeutically if necessary as well. So again, stress, physiological, psychological, environmental, and I would add physiological. So if you have inflammation, that's a form of stress that can stimulate this pathway. So you get corticotropin releasing hormone to the pituitary gland, which secretes adrenocorticotropin hormone, and that goes to the adrenals. You secrete cortisol, and then that is a feedback loop as well. And so cortisol is what we're measuring on that saliva panel. And then adrenal function also has a huge impact on reproductive hormone production as well as thyroid function. So too much adrenal secretion of cortisol can inhibit conversion of T4 to T3. It can also, adrenal function helps to regulate production of the reproductive hormones, especially in menopause. And so proper adrenal function is necessary to make sure we have adequate thyroid and reproductive hormone function as well. And so let's go to the reproductive hypothalamic pituitary gonadal axis. So here we're not necessarily looking at high and low, we're looking at the differences between male and female. So when we have hormone issues in females, this can affect libido, desire, can cause facial hair growth, acne. If she's premenopausal, can cause problems in the menstrual cycle, lots of pain during the menstrual cycle, and mood changes. Peri and postmenopausally, it can cause the same issues with libido, facial hair growth, and acne, but it also can cause hot flashes, fogginess, mood swings. And then in men, again, low libido, mental fatigue, issues with concentration, depression, decreased stamina, increased emotions. And so when we're evaluating this axis, we want to test the free fraction hormones so we can actually see what the levels of the active hormone are. For cycling females, it may be necessary to test throughout the whole month because obviously her hormones do cycle over the course of 28 days, so you don't want to just test on a random day. You want to test the rhythm throughout the entire month. And then even once we get to the therapeutic part, we want to make sure that we're not jumping right to hormone replacement. We want to address other factors that influence hormones, things like your thyroid and adrenals, as we mentioned already, but blood sugar, inflammation, anything that can have an impact on thyroid or reproductive hormones, we want to address those things first before jumping to hormone replacement. And here you see from the pituitary gland, we have the follicle stimulating hormone and the luteinizing hormone going down and stimulating the production of estradiol or estrogen to maintain and develop the reproductive tissues, and then to the testes for production of testosterone. Reproductive hormone dysfunction can negatively impact the brain, the thyroid, and the adrenal function. And so the question becomes, are each of these pathways being properly evaluated for you with testing and then addressing them with a functional approach? And here's our real life story. We had a 43-year-old female come in. She had weight issues, fatigue, and hormone dysfunction. Her doctors had found some anemia, so they placed an IUD to help with that. As soon as it was placed, she had continuous bleeding. So after 4 months of bleeding, they decided to put her on birth control. Still no change. She came to see us. It was about 9 months total she had been bleeding. So we just decided to run the 28-day panel for hormones. And here's what we've got. So this is her estrogen over the course of we actually did it for 34 days since we didn't even really know when her cycle was stopping and starting because she was constantly bleeding. So estradiol, if you look at the cycle reference range, starts low and then spikes and then drops back off. So really this follow the arrow. This is what estrogen should do. Spike, and as you can see, the spike is between 3 and 8. Well, the top of this graph is 0.8, So the spike should be about 10 times higher than this graph even represents, and then it should come back down. So her estrogen was very low and inadequate, and even then it was spiking and crashing. Then we look at progesterone, and for the first half of the cycle it's supposed to be pretty low, and then it's supposed to spike at the second 2 weeks of the cycle, about 250 to 350, and you can see this graph stops at 100, so it should be about 3 times higher than that, the progesterone peak. So her hormones were wholly inadequate. So what we did, we supported better hormone production. I didn't give her any hormones, but we supported through diet, nutrition, better hormone support through the HPG axis, as well as supporting other areas. And within 4 weeks, literally, she had a normal cycle. It was pretty amazing. Our sixth key to unlocking the mysteries of chronic conditions is energy production. And in regard to energy production, we're talking about not just global, do I feel like I have enough energy to do my next task, but what does the cellular energy production look like down at the cellular level? And there's a specific piece of machinery that's responsible for production of energy in your cells. It's called the mitochondria. A healthy version of that mitochondria is pictured here on the left, and an unhealthy version is here on the right. All of your cells require energy in order to do their jobs. They use a specific molecule for energy called ATP. It's really the currency of energy in your cells. That ATP is made in these mitochondria from the oxygen you breathe, as well as from the food that you eat. All the fat, protein, carbohydrates that you digest get combined with oxygen and create this ATP molecule in the mitochondria. When we have problems delivering that oxygen and food products to your cells, or we have degeneration of the mitochondria, this can alter the production of energy at the cellular level and therefore contribute to diseases. It can lead to things like cancer, cardiovascular disease, endocrine dysfunction, neurodegenerative diseases like Parkinson's disease, Alzheimer's, or dementia. Most of this is triggered by oxidative stress, which is when free radicals are not quenched, so to speak, with antioxidants, and I'll get into that more in a few minutes. Interestingly enough, the mitochondria that you have, they only come from your mom through the egg. None of the mitochondria come from the sperm. And these mitochondria have their own DNA, even though they themselves are not cells, they're parts of your cells. And so we can use that DNA actually to trace family lineage. Mitochondria are so important that 10% of your total body weight is actually mitochondria. So if you weigh 150 pounds, 15 pounds of you is actually mitochondrial weight all by itself. 25% of all of the energy that you use is used by your brain, but overall your brain has fewer mitochondria per cell than other areas of your body, so your brain is more susceptible to poor mitochondrial function. So this is an illustration of the conversion of your food into energy. So when you eat foods, proteins, polysaccharides really is carbohydrates, and fats, all of those things are broken down into a common molecule which enter a process called the citric acid cycle and end up through what's called oxidative phosphorylation. That oxidative part is where the oxygen comes in. So we're adding in food plus oxygen and we get that energy molecule ATP. So what types of things can go wrong with this process? Well, first of all, you can have oxidative stress. Now, oxidative stress is a normal byproduct of metabolism, but we're supposed to have adequate levels of antioxidants to counteract these oxidants. Think about oxidative stress as the smoke and soot that comes from the normal burning of fuel. It's a natural byproduct. We can also have too many calories to contribute to mitochondrial dysfunction. Too many calories, using that same analogy, is like flooding the engine with fuel. It makes the soot and the smoke much worse. You can have too much glucose, which is insulin resistance or diabetes. You can have too much fat buildup. You can have exposure to environmental toxins, things like cigarettes, metals, medications, including Tylenol, aspirin, statin medications for cholesterol, antibiotics, chemotherapy drugs, anti-seizure medications, all are known to create dysfunction in the mitochondria. And even micronutrient deficiencies, which ends up being very common in a lot of patients, things like magnesium, calcium, zinc, iron, copper, all can be low, contributing to dysfunction in the mitochondria. So the question becomes, well, how can we protect ourselves, or how can our body protect itself from mitochondrial dysfunction? Number one, the body has enzymes to break down these free radicals or reactive oxygen species that are normally produced during metabolism. They have enzymes to break down this oxidative stress. We also have antioxidants that we get or should get from our diet, including vitamin C, vitamin E, carotenoids, and flavonoids from fruits and vegetables. And then your body has antioxidants that it makes as well, things like glutathione and CoQ10, and we can actually supplement with these to make sure that this mitochondrial process is functioning as best it can. Because when it does not function, we result in many different diseases. In fact, more than 50 million adults in the US suffer from diseases which involve mitochondrial dysfunction. Things that include diabetes, heart disease, kidney disease, blindness, headaches and migraines, infertility, liver disease, Alzheimer's, Parkinson's, ALS, stroke, autism, chronic fatigue, cancer, cardiovascular disease, mood disorders, chemical sensitivities, premature aging. All of this can be related to mitochondrial dysfunction, and the neurological ones like Parkinson's and Alzheimer's and others are because the brain is highly vulnerable to oxidative damage. So what can we do? We talked about the things that the body uses to fight this off. One of them had to do with the food that you're eating. So eating a diet that's high in fat and lower in carbohydrates and high in fruits and vegetables helps your body to produce more ketones that are a great source of fuel for the brain's mitochondria. This type of meal planning also helps to reduce inflammation, create more mitochondria, increasing ATP production. It reduces that oxidative stress, reduces cell death, decreases insulin resistance, and even intermittent fasting helps to switch your body to burn ketones as well. Second thing is exercise, and this could be physical and cognitive. Both help to increase mitochondrial density, reducing insulin resistance as well. And then phytochemicals, things that we get from foods, but we can also supplement with in higher quantities, things like alpha lipoic acid, curcumins, quercetin, resveratrol, and branched chain amino acids. So let's take a look at energy production in real life. This is a patient, her name is MG, and we have talked about her before in regards to the detoxification biotransformation. Just to review her symptoms again, as it relates to the energy production, we could probably look at muscle pain and weakness, shortness of breath, fatigue, the diarrhea, the brain fog, weight issues, menstrual cycle problems. She's not making enough energy at the cellular level, contributing to some of these symptoms. And when we ran her organic acids tests, looking at the energy production markers, we see that ATP production is diminished. And so we needed to work on that with her in terms of supplementation. We talked about CoQ10 being helpful. And when we worked on these things, in addition to the other issues that we found, as I mentioned before, she's feeling so much better and likely is very thankful, and she is very thankful that we've helped her with her energy production. Key number 7, and I'm particularly fond of and maybe a little biased towards the 7th key, which is neurological function. As a functional neurologist, I want to look at everyone's brain and figure out how is it working, where are the dysfunctions, and how are those dysfunctions contributing to everything else that's going on. And as you've noticed throughout our discussion so far, I've mentioned neurological or brain function probably in every single one of the other ones. And so we can't really talk about one of the keys without also involving the others. They are all interconnected and have an impact on one another. So looking at neurological function, the first thing I want to talk about is in relation to energy production. So if you remember, we just looked at energy production in the mitochondria, and we talked about the fact that the brain needs most of the energy that's being produced by the body. And so when we have dysfunctional mitochondria or energy production, then it's going to have an impact on brain function. I want to talk about, if you look at the left side of this graph here, we're looking at oxygen, glucose, and stimulation all help to produce healthy mitochondrial function, and then healthy neuron function there because of that. Three things that the brain needs to be healthy: food and oxygen, and activation or stimulation. You're going to hear me repeat that over and over again because that's how we help to improve brain function, is by addressing those three components. So if we have those three components and we have good mitochondrial function, we're going to get our energy, you're going to have good neuronal endurance, your brain is going to be able to complete tasks without fatiguing. The problem becomes when we have interruptions of these things and we have less oxygen because of poor circulation or anemias. We have dysfunctional glucose delivery because of dysglycemia, reactive hypoglycemia, or insulin resistance. We have a lack of stimulation because of a lack of activity, whether physical or cognitive. And then we have things like inflammation and autoimmunity, environmental toxins that help to decouple the mitochondrial process. Therefore, we have less ATP and poor neuronal endurance, and we get fatigue whenever we try to use our brain. I do want to credit Functional Neurology Seminars and Drs. Datis Karazi and Brandon Brock for this diagram, as well as the next one here. So depending upon where we have fatigue and the level of the fatigue that we're seeing in specific areas of the brain, it's going to create certain types of symptoms. And so it's all about the location of the brain that's involved, and then what function does that part of the brain normally control. And if we have dysfunction, for example, in your cerebellum, you're going to have difficulty with fatigue while you're standing. As it gets worse, you're going to have muscle spasms in your neck and your spine, and you're going to have potentially some vertigo and maybe some tremors and get car sick or seasick. If you've got frontal lobe fatigue, you're going to have difficulty with concentration and focus. If you have basal ganglia issues, you're going to have difficulty with cramping of muscles, maybe in your hand while you're writing. And so it just depends on where we see the issues is going to indicate what types of symptoms are going to be involved. And so we work with your symptoms and try to kind of reverse engineer it through an examination to determine which areas of the brain are involved. So I want to talk about with you some of the areas of the brain that we typically look at as it relates to symptoms in most of our patients. And so this is a brain, and just to orient you, we're looking at it from the left side. Where this arrow is, this is the front, this is the back over here, this is the bottom, and this is the top. So this arrow is pointing at your frontal lobe. Frontal lobe is where we have all of our executive function. So things like focus and concentration and decision making, planning, organization, motivation, drive, interests, restraint of impulsive desires or impulsive actions happens here. And so when we have dysfunction in this area of the brain, we see dysfunction in all of those activities. Next area of the brain that I want to look at is the back part of the frontal lobe, which is your motor cortex. And so we might have difficulty with muscle endurance or loss of strength in muscles on one side versus the other, or maybe some muscle tightness in one side or the other. Any type of motor involvement of symptoms, we want to look at the motor cortex. Just behind the motor cortex in the front part of the parietal lobe is the somatosensory cortex. And so this is where all of our sensory information is processed. So all of your pain and temperature sensation, touch, vibration, position sense of all of your joints is processed in this somatosensory area. And when it becomes dysfunctional, we might have difficulty in perceiving where your limbs are, difficulty with spatial awareness. Maybe you're bumping into things more frequently. Maybe you have a recurring injury on one side of the body versus the other. Or maybe you're just hypersensitive to touch or pain. That is all processed in the parietal lobe. This is the temporal lobe, and the temporal lobe has a couple of different areas that are involved. And the one that I want to talk about first is in regards to the auditory cortex. So this is where all of your sound is processed. And so if you have difficulty in overall hearing or interpreting speech with background noise, or comprehending language, or needing to look at someone and kind of lip read while they're talking, this can be involved with the auditory cortex. And then more importantly, in regards to a lot of the patients that we typically see, is the medial temporal lobe and the hippocampus. This area is involved with memory. So if you have memory that's less efficient, or memory loss that impacts your daily activities, or you have confusion about dates and time and places, difficulty retracing your steps or finding your way while you're driving, forgetting your keys, difficulty remembering names or faces, all of this is involved with medial temporal lobe and hippocampus and memory function. What we're looking at here is your occipital lobe. And your occipital lobe is where all of your visual processing happens. And the visual processing, when it's dysfunctional, can result in symptoms that have difficulty in discriminating different shades of the same color, dullness in your visual field, difficulty coordinating visual inputs and hand movements, and then maybe some floaters or halos in your visual field as well. This is your cerebellum down here. Your cerebellum has three different functional areas that I want to mention: the spinocerebellum, the cerebrocerebellum, and the vestibulocerebellum. So issues in the spinocerebellum can cause problems with balance, and so maybe you need to hold on to the handrail when you go up and down the steps. You feel unsteady, maybe you fall more in the dark, maybe you sway one side to the other. The cerebrocerebellum is going to cause more of a clumsiness type of an issue: tripping, clumsiness with your hands, dropping things, maybe a little bit of a hand tremor or shaking. And the vestibulocerebellum is going to cause issues with dizziness or disorientation, maybe some nausea or car sickness, feeling disoriented, or shifting of the environment. Can also cause back muscles to become tired and tight, and can even cause anxiety in crowded places. This last place down here with the arrow at the bottom is involved with your brainstem. Your brainstem controls a lot of your automatic or autonomic functions, and what we look at in regards to this is your parasympathetic versus sympathetic activity. So when we have reduced or diminished parasympathetic activity, this is going to cause difficulty with swallowing food or supplements, slower bowel movements or constipation, chronic digestive issues, dry mouth or dry eyes. A lot of times when we have reduced parasympathetic activity, we have an increase of sympathetic activity. And so this can cause tendencies for anxiety, being easily startled by loud noises or bright lights, so you have a sensitivity to those flashing lights, racing heart, difficulty relaxing, and even difficulty falling asleep can all be attributed to differences in function in the parasympathetic activity as well as sympathetic activity as it's controlled by this area of the brainstem. One last area I want to talk about is in the basal ganglia, which is deep to these structures. So we'd have to peel this away and see the deeper basal ganglia structures. You have a direct pathway and an indirect pathway for the basal ganglia. Basal ganglia direct pathway, if it's dysfunctional, you're going to see slowness in your movements, stiffness in your muscles, cramping in your hands, stooped posture when you're walking. Your voice may become softer, and maybe you have a facial expression that everybody looks at and kind of thinks you're angry or upset. The indirect pathway, when it becomes dysfunctional, you have uncontrolled muscle movements, an intense need to clear your throat or contract a group of muscles. A lot of times we'll see obsessive compulsive tendencies or Tourette's type behaviors. Constantly nervous or having a restless mind may also be associated with the indirect pathway of the basal ganglia. So with all these potential dysfunctions in brain and the symptoms we described, most of the people we talk to have at least one of those things. And likely you do as well. If not, fantastic. But we want to look and ask the question, have you had a proper neurological evaluation? Has anybody looked at all of those different components? We do a functional neurological examination to evaluate how each of those areas that we just talked about is actually working or not. If we have more advanced neurological symptoms, we might also recommend a quantitative electroencephalogram or a brain map or EEG. This is going to help us to compare your brain directly to a database of other people that don't have any symptoms. So it's an apples to apples comparison. In terms of people your age, we're comparing you to them. We're looking at these areas of the brain and even deeper structures to see how are they working in comparison to somebody that does not have any symptoms. And that really helps to guide and direct a therapy. Once we've identified the areas involved, then we can work on restoration of function in those areas. And the way that we do that, as I mentioned before, is by providing adequate oxygen and glucose or fuel and food, by addressing metabolic issues. All of the other components or the keys that we just talked about, most of those address that, and then providing adequate activation or stimulation of those areas of the brain helps them to function better as well. What about neurology in real life? I want to share with you a story of a patient that came in that had dystonia. Dystonia is when you have certain areas of your body that cramp up and stay contracted for long periods of time. And this is involved with the direct pathway of the basal ganglia. This particular patient had had severe contractions mostly on the left side of her body. Her hand and wrist would fold over, her foot would turn in, her neck would bend over and rotate, and she was kind of stuck in that position. And you can kind of see what that might look like in the picture over here on the right hand side. This was going on with her for 15 years. It happened 3 to 4 times a week, and every time it happened, it lasted about 5 or more hours. She came in really with no hope in the care that she had received thus far. We identified the areas of the brain that were involved. In particular for her, it was her right motor cortex and the basal ganglia. We applied therapies to those areas and had her begin doing those, in addition to making some changes with what she was eating and some supplementation. And her dystonia went away completely. She had only one episode while under our care, and that was in the beginning as things were starting to improve. And her story is truly amazing, and her life was literally changed because we took the time to identify what was going on and give her the proper course of care. So that wraps up the 7 keys to unlocking the mysteries of chronic conditions. And just to review, number 1 was gastrointestinal or gut function. 2 was immune and inflammation. 3 was detoxification or biotransformation. 4 was cardiometabolic. 5 was endocrine. 6 was energy production. And we wrapped up with the 7th, which was neurological function. Before we move on to the last point that I want to make in regards to offering you an opportunity to see if we're a good fit to work together, I want to share a story with you of an actual patient from our office, and she's going to share that in her own words. So let's go ahead and listen to that.
Thyroid issues, overweight, headaches, especially migraine headaches, making me lose time at work. Saw it on Facebook and decided I would just check into it. I had tried Weight Watchers for the weight control. That was not successful. Had been back and forth with my doctor, family practice doctor, with several tests done, nothing really showing anything. I felt like I was hitting a brick wall. Weight loss drastically dropped. I'm down 23 pounds, I'm happy to say. I no longer have headaches. I have not missed work due to sickness. I feel great. I never thought I could feel this good again. It makes me feel good, and it even makes my family feel good to see me have energy and be able to do things that I was not doing anymore. I wasn't getting out and working in the yard like I used to love to work in the yard. I mean, basically all I was doing was getting up, going to work, and coming home and crashing. I didn't have a life outside of work. I would work and come home, and that would be it. But now I'm able to go and do things that I enjoy doing, working in the yard. In fact, this past weekend I worked in the yard for 4.5 hours. And today and all through the week I've been very sore. Try it. What have you got to lose? I mean, it'd be the best thing you've ever done.
Wasn't Tammy's story so encouraging? Being a small part of helping to create stories like that is what makes it so exciting for our whole team at New Life to come into the office every day and help our patients to change their lives. Really, the next step is to see if we can help change your life as well. And kind of how the process works for that is we always start with a private consultation. So in the consultation, you come into the office, we sit down, we talk about what's going on. If you're far away, which a lot of patients that we help are quite a distance away, so if you're more than an hour from our office, we'll be happy to meet with you virtually, either by phone or through a secure teleconference portal that we have as well. But during that time, which is normally valued at about $167, it's free if you make your appointment today. When you call the office, just tell them that you watched the Chronic Conditions video, and they'll get you scheduled for that free consultation. But what we're going to go over during that consultation is I really want to dig deep into thinking about what is the cause of your symptoms. So we want to figure out what are potential underlying root causes of why you're feeling the way you do, because we don't want to just put a Band-Aid on it. We actually want to address the problem and not just mask it. So we're going to talk about
all of the things that you're dealing with, and then I'm going to talk about what are the potential contributing factors for each of those things and tie it all together for you. And if you're in the office, I'm going to actually draw that out on a whiteboard for you so you can kind of visually see it, and then you can take a picture of that and you have it for your records. But it kind of really ties everything together so it makes sense for you in regards to what's going on. And then we're going to answer the question, can we even help you? So after I lay all that out, some cases, honestly, I have to let you know that we can't help, and we'll be honest with you, and we'll point you in the right direction if we can to someone who can help you. But when we can help, we'll let you know that. We'll say, yeah, you're a good fit. Here's what we need to do in terms of testing. So we'll lay out exactly what tests we need to do to confirm my suspicions. So everything we lay out in step one, what's causing the symptoms, that's my suspicions, but we don't necessarily want to just go on the suspicion. We want to run the proper diagnostic tests for you to confirm that. And so we'll lay out what diagnostic tests are necessary, and then we will go over the cost associated with that as well. So the retail costs of these tests could range anywhere between $7,000 and $9,000, and that's a lot of money, right? So we get discounts on these tests through a couple of testing co-op companies that we're part of. So we just pass those discounts along to you as well. So depending upon what testing you need, you can probably expect a range anywhere between $900 and $1,900. So why the wide range? Well, it really just depends on what we need to do for you as an individual, but that's typically what we'll see on average for our typical cases. Some cases are a little bit less than that range. Some, on a rare occasion, are a little bit more, but that's a good range that you can expect. We want to be transparent in every step in the process, so that's why we're letting you know what to expect when you come on into the office.
So how do you make an appointment? Go ahead and call the office, 864-757-8500. You can also go to the website, renewingfunction.com, and right underneath the video on the front page, there's a button that says Schedule a Consultation. You just click on that button, fill in the information, and one of our team members will get back to you to schedule at a time that works well for both of us. I want to talk about one question that people typically have when they call our office or are interested in our services, and that is, does insurance cover the cost of the care that we provide? The insurance that most people have covers the medical standard of care, and so that means things that are the standard treatment for various conditions is usually what insurance covers. The medical standard of care and what is offered in that is determined by the insurance companies and really the pharmaceutical companies as well. So take example thyroid. The standard of care for thyroid disease, hypothyroidism, is a thyroid medication, and that's really all they're going to pay for your thyroid disease. And so the standard of care for whatever chronic condition you're dealing with, like I said, is determined by the insurance and the pharmaceutical companies, and that standard of care is likely what you've already received up to this point. And really, if you think about it, if that care had worked for you and helped you to get your health back, you probably wouldn't really be watching this video. And the reason why you need a healthcare team like us is because insurance paid for care that you've already received in most cases, but obviously at this point it likely didn't help you to reach your health goals. So in regards to chronic conditions, the medical standard of care is really inadequate, as hopefully you have realized after watching this video. So if you want something different in terms of your health care, you'll likely have to make a personal investment in your health. So insurance really is designed to pay to keep you alive. So if you have a life-threatening illness or emergency, they're going to pay to help keep you alive, but not necessarily help improve the quality of your life, and certainly not help to pay for preventative care. This is an example of a hospital bill from a patient last year, and to blow up so you can see it, the balance was $153,000 for about 6 days in the hospital. And if you break that down hour by hour, it's about $1,000 an hour for care in the hospital. And that saved the person's life, but it didn't necessarily get that person's quality of life back. And unfortunately, that's just kind of the way the system works. Now, our care doesn't cost anywhere near that much, but we're able to figure out what the underlying issues are that are preventing improvement in quality of life, and we can help address those issues as we've talked about throughout the video. And when we do that, we see improvements in quality of life. Think about your health insurance in terms of car insurance. Your car doesn't pay for routine maintenance nor for regular upkeep of your car. And really, in the same way, health insurance doesn't pay to maintain your health. That's really the responsibility of each of us as individuals. I had a patient come in one time. He had been in the hospital for about 17 days, and test after test was run, and the doctors were trying to figure out what was going on. And he had a chronic viral issue that came back to really cause a lot of neurological issues for him. And his wife actually found us while he was in the hospital, realizing that they were going to keep him alive and they needed someone to help him with his quality of life. And so they contacted us while he was still in the hospital, set up the consultation. And when I talked with him, he and his wife said that the doctors called him the $1 million man, because they literally ran over $1 million worth of testing on him, but they still didn't help him with his quality of life. So if you find yourself in a position where you don't have the quality of life that you're looking for because of the health issues that you're experiencing, then we're likely a good fit to work together. It's just going to require an investment in your on your part in time, in terms of time, effort, and likely a financial investment as well. This is a quote from the Medicare guidelines, and it says directly in there that a treatment plan that seeks to prevent disease, promote health, and prolong and enhance the quality of life, or therapy that is performed to maintain or prevent deterioration of a chronic condition, is not a Medicare benefit. And so it says it right there, they don't pay for this type of care. And most private insurers will follow Medicare rules as well. Oftentimes, I've never actually had a patient come back to us at the end of their care and say, man, I feel great, but it really wasn't worth the investment that I make. No one has ever said that. In fact, multiple times people comment about how they felt initially making that investment and then afterwards. And so I've shared a couple of examples here for you. Mr. Henson said it costs some money, but boy, is it well worth it. And Susan had the right perspective, saying, without your health, what do you have, in terms of making that investment in her health? And Julie Gallman said, when asked about recommending people to come see us, she said, do it without hesitation. Even when I hesitated before, I thought, wow, this is going to cost money, but it's my body and this is my life and it's worth it. And all three of these people saw amazing results with the care that we provided for them because they chose to make an investment in their health. And ultimately, it is an investment and it's not an expense, although it can become an expense if you don't take the time up front to make an investment in it. So again, if you're interested in moving forward, if you have not done so already, contact us today to schedule an appointment to see if we're a good fit to work together. Renewingfunction.com. You can click on the button there, call the office 864-757-8500. If we've already seen you in the office or you've already scheduled your appointment, fantastic. We look forward to moving on to the next step with you. I want to thank you so much for taking the time to listen to the video today and to watch and learn more about how we can help with chronic conditions. If it's not a good fit for you, but you enjoyed the video, again, thanks for watching. Feel free to pass this on to someone you might feel could benefit from it. Thanks again for listening. Have a wonderful day. Take care.